Amendment number 2. Representative Pine.
Yes, Mr. Speaker, thank you very much for the opportunity. This bill relates to what's otherwise known as Obamacare, and it purports to want to save Hawaii's Prepaid Health Care Act. But the State Attorney General has said this bill will jeopardize Hawaii's health care law because this change will trigger preemption by the Federal Employee Retirement Income Security Act of 1974, otherwise known as ERISA. The Attorney General, appointed by Governor Abercrombie, is saying this bill would damage our healthcare system. So why are we pushing this legislation here today? This bill acknowledges that the Affordable Health Care Act of Hawaii, also known as Obamacare, is not as good as Hawaii's Prepaid Health Care Act. So why are we in this chamber wanting to implement parts of Obamacare when this own bill is saying that our own Hawaii's Prepaid Health Care Act is superior to Obamacare? The Hawaii Congressional Delegation reportedly put language in Obamacare bill to protect Hawaii's Prepaid Health Care Act. So basically, what the Attorney General is trying to say, Mr. Speaker, is we got this exemption from Obamacare, but today what we are doing is making changes to the very law that got that approval for us. And so really what we're just asking is if we can instead do a task force that can include our congressional delegation, include members of the House and Senate, include people in the health industry, our health director, to give us a little bit more time, because our congressional delegation, as you know, Mr. Speaker, worked extremely hard on passing Obamacare for the American citizens, and they worked extremely hard to ensure that since we have one of the best healthcare systems in the nation, that our healthcare system would be excluded from having to be a part of this act. And it was because of this exemption that we felt in Hawaii that our health care would not be in jeopardy, because it's doing pretty good right now for our citizens. So by us passing this piece of legislation today as is, without instead turning into a task force where we can look into this and work with our congressional delegation and people that understand ERISA better, we are therefore putting in jeopardy our ability to be exempted by the Obamacare Act.
Thank you very much. Representative Ward.
Speaker, I also rise in favor of this amendment.
Please proceed.
The amendment to buy some time to think, to contemplate, to reason before we move, or we contemplate before we jump into this. In addition to what the minority floor leader said, I'd like to add 3 questions. 3 that hopefully we will all contemplate. Wouldn't repealing the termination clause subject Hawaii's Prepaid Health Care Act to lead to possible lawsuits? And are we willing to put out the money at this time of hard economic times to defend HB1134? And would it likely not create more confusion in already a process by which, as you know, some of the colleagues said, well, let's pass the bill first and then we'll read it and understand it second. And we know that the bill has come in almost at twice the cost from the CBO estimates. The second question is, if the goal is to preserve the Hawaii Prepaid Health Care Act, then what happens if a national health care plan comes along that is better than the Hawaii system? Do we then need to undo this bill? And then question 3, which is as important, would the sponsor of this bill please explain what ERISA does and why he is willing to allow ERISA to preempt our state prepaid health care law that has worked so effectively over the past 35 years? Speaker, the question is, would the chair of the Health Committee be so gracious as to stand up and respond to the question regarding ERISA and what we may be risking or not risking according to his assessment of having passed this bill? That is a question that...
Mr. Speaker?
Representative Yamani.
Thank you, Mr. Speaker. I am not the primary introducer of this measure, and I will ask for a brief recess.
Recess.
If anybody wants to ask me a question, they feel free to.
Recess. Subject to the call of the chair. Would the House please come to order? Representative Ward.
Speaker, with your permission, to redirect the question to the actual sponsor of the bill, who probably knows ERISA very well, because I know he's read ERISA, he's read the bill, and he usually thinks some of us haven't. So his enlightenment would be greatly appreciated.
So ordered. Representative